Well, we have Dr. Harshvardhan with us, but he's not obviously on ground. It's a virtual session. Thank you for speaking to us at the India Economic Conclave. Dr. Harshvardhan, first and foremost, a year ago, India had observed Prime Minister Narendra Modi called a people's curfew, a Janta curfew, marking the start of a nationwide lockdown. You might also recall that it was a bid to contain, viewers, the virus. It, of course, has succeeded. But now we're seeing a second surge, Dr. Harshvardhan. Is the government worried?
Not at all, Rahul. India, with a population of 1.35 billion, has marked socio-economic and cultural diversity. In this milieu, with the concerted efforts of the central and the state governments, India has recorded one of the lowest cases and deaths per million population of 8,469 and 116 respectively. Further, the case fatality rate of 1.37 is also the lowest when compared to similarly placed countries.
Well, let me ask you, I think those are very illuminating statistics, Dr. Harshvardhan. How do you see this second wave playing out? Any timelines?
Yes, we are witnessing a surge in cases in many states. We are closely monitoring the situation. In the initial part of the pandemic, we had to establish everything from scratch, be it the surveillance, the laboratory capacity, the dedicated hospital infrastructure for COVID, the logistics, and not to forget creation of the public movement for COVID appropriate behavior. We have amply demonstrated that our policy of test, track, and treat effectively contains the transmission.
Right.
Now that the systems are in place with renewed focus on containment, mitigating the impact of COVID on high-risk populations, and re-emphasizing on COVID-appropriate behavior, we will be able to manage the second wave.
Okay, well, would not a strategy built around containment also mean the universalization of vaccination, sir, quicker? Perhaps it will play a very crucial role, more so than ever before?
Rahul, India has maintained one of the lowest positivity rates and mortality rates across the world.
Indeed.
This has been sustained through test, track, and treat strategy followed diligently by the Government of India. And we continued the emphasis on preventive measures to contain the spread of the virus, which includes wearing masks, washing hands, use of sanitizer, adequate physical distance, prompt testing on observing symptoms, and prompt isolation on testing positive. Further, ongoing COVID-19 vaccination drive also has a crucial role in India's pandemic response by protecting those at highest risk of mortality due to COVID-19 and also providing immunity to healthcare workers and frontline workers involved in surveillance, containment, and management of COVID-19.
Right. I want to ask you, because there's been so much talk about this, spoke to the RBI governor about potential COVID-induced disruptions, at least the second surge, bringing about disruptions. Is there a probability or a possibility, potentially, of a lockdown, a second wave of lockdowns, Doctor?
I would like to answer the second part of your question first. You see, vaccination of people is ongoing and is increasing its pace with each passing day. priority group have been identified on the basis of recommendations of National Expert Group on Vaccine Administration for COVID-19. The focus is on protecting those at highest risk of mortality and those involved in pandemic response. As of today, 5.31 crore vaccine doses have been administered in the country. You may appreciate that in January per day coverage was 2.4 lakh per day, whereas in the last week of March, it was 20 lakh doses per day. Now, the government has expanded the coverage to citizens above 45 years. The pace of vaccination is going to increase further.
Yes.
As for imposing restrictions, you must understand that COVID-19 situation continues to evolve and change each day. The silver lining here is that we are better prepared now to tackle any challenges that it throws our way.
That's true.
Decisive steps which include strict enforcement of COVID protocols as well as creating micro-containment zones wherever needed will be used to keep a check on the rise in number of cases.
Okay, so we're actually looking at quite a holistic approach and perhaps not the specter of another lockdown. Well, Dr. Harshvardhan, you are emphasizing a lot on the vaccine drive. How could you make this into a Jan Andolan? How do you see the present vaccination drive going on in the country? And what are the future plans now in this regard?
Stakeholders across ministries, departments, professional bodies, medical colleges, NGOs, CSOs, media houses, private sector, youth and women network have been involved in this drive, which is being coordinated as a Jan Andolan. The ongoing vaccination drive is being strengthened on a daily basis to increase the number of vaccinations administered each day. As mentioned earlier, now the priority group has been expanded to cover all citizens above 45 years of age. It is a dynamic process, and the government is working round the clock, evaluating various parameters with the intent to expand the umbrella of coverage to other sections of the population.
Well, you yourself, and I'll quote you here, you've said that we have to have a very people-centric approach, and whatever you do in the labs, it should have a connect with the people for the future. Could you elaborate?
Rahul, I have often iterated that science and all its progress is a waste if the fruits of these advancements are not reaped by the society. Translational science is as important as fundamental science and research. We are thus providing impetus to people holding socially disruptive ideas to develop technologies that can be scaled and implemented at the grassroots to ease the life of our citizens. The government is extending financial and policy support to social entrepreneurs to nurture path-breaking ideas which can greatly benefit our people.
Well, Dr. Harshvardhan, we've been seeing that some of the targets for vaccination are not being met. Now, I want to ask you a direct question. Do you believe that there is still a residual hesitancy in people regarding the vaccination? And if so, how do we overcome this? How does the government plan to address this, especially now that we've opened up or you've universalized it at least to 45 plus?
Our communication strategy is adequately prepared to sustain vaccine confidence and address any vaccine hesitancy among population. The same is being implemented across states and UTs. Communications National Media Rapid Response Cell has been established at the Ministry of Health and Family Welfare for early identification of any misinformation or rumor and countering the same with correct information. Frequently asked questions for general public and healthcare and frontline workers have been developed and widely disseminated. Experts have been identified for op-eds and articles to build vaccine confidence. Fact-check videos by key experts have also been prepared and disseminated to provide correct and factual information for the general public.
Well, that's very welcome. But Dr. Harshvardhan, you've said that every vaccine doesn't require universal immunization. So clearly, you're not very open to that idea. And you've also said that priority groups are being identified, keeping in mind WHO guidelines. Now, given this, what exactly are the government's targets for the coming months, and how do you plan on achieving them in the context of this hesitancy?
The government is keeping a close watch on the number of beneficiaries being vaccinated each day and number of people in the prioritized age group vaccinated till date. We are also ensuring supplies of vaccines to the states as per their per-day vaccination capacities. We plan to expand the target beneficiaries by relaxing the age group of the population eligible for vaccination. In this regard, it may be noted that from 1st of April, any person above the age group of 45 years
Indeed.
can get vaccinated by registering himself or herself on the CoWIN platform.
Okay, but obviously, sirs, I'm sure that the rollout will also sort of be taking into account the other breakthroughs in vaccine development. Now, does the government have any plans to scrutinize for emergency authorization other vaccines throughout the country, or are we going to just have this two-horse solution?
Around 6 vaccines are in different stages of trial.
Right.
And will be granted complete all statute is looking in this matter as already emphasized. This is a dynamic process.
Okay, so it'll evolve as we go along. I just wanted to ask you, Dr. Harshvardhan, you're obviously not somebody who believes that every citizen needs to be vaccinated, but and this is where the paradox is. Given the dynamic nature of this violence, would it not be prudent to actually cover everyone? Or is it just completely an irrational sort of exercise which one can never hope to complete?
Rahul, the history of this coronavirus is unknown. The disease COVID-19 is very dynamic in its behavior. So from day one, we are only relying on the evolving scientific evidence to drive our decision making to mitigate the impact of the pandemic.
Yeah.
Our containment strategies to check the spread of the virus that have been praised the world over were based on such scientific inputs.
Sure.
We are carrying out genome sequencing of the virus to keep a track of any changes in its propensity or nature. The vaccination drive is being conducted in accordance with emerging science-based data analyzed through scientific algorithms, which also suggests that if a majority of our population, including the targeted priority groups, are immunized against COVID-19, we shall be able to get a control over the disease. Even if you have enough people vaccinated, these actually give enough protection in the population to prevent the virus from actually going from one person to the next. So it's really like having a barrier of people who are protected, who break that chain of transmission.
Right.
So you don't need every single person in the area in the population to necessarily be protected. This is like achieving herd immunity through vaccination.
Sure. I think you're making a lot of sense, and I'm sure the audience here will also sort of agree with you. But the opposition constantly says, Dr. Harshvardhan, that we should leave it upon the citizen to decide when, if at all, to take the COVID vaccine. What are your thoughts on this?
NEGVAC is guiding all aspects of COVID-19 vaccination, including the schedule of vaccination based on available scientific evidence. The vaccination remains available to priority groups only and is voluntary. However, it remains our responsibility to provide correct information to the citizens about the availability of vaccines, its correct schedule and efficacy, which we are doing on a regular basis. The vaccination process has been made people-centric. Self-registration by beneficiaries, on-the-spot registrations, facilitated cohort registration, increasing the duration of vaccination services offered at the COVID-19 vaccination centers, increasing the number of such centers by involvement of private sector health facilities, etc. In the future also, similar initiatives will be undertaken as per evolving need to make the ongoing vaccination drive even more user-friendly and ensure a hassle-free vaccination experience to the beneficiaries.
Well, that's very comprehensive, at least by the sounds of it. I want to ask you this, Dr. Harshvardhan. This is a very quickly evolving genome sequence of COVID-19. It mutates very, very quickly. Now, some of these vaccines might actually become ineffective. Do we have a contingency plan in place to deal with these other mutants?
Rahul, present vaccines are effective against the SARS-CoV-2 and the current variants. We are keeping a watch on the evolving scenario and will further strengthen our program as per available scientific evidences.
So it's an endeavor where you sort of react more than preempt. I want to ask you, sir, talking about preemption, we were almost out of this COVID spiral. And now we're seeing a second surge, and Maharashtra, Punjab, Kerala, Karnataka, Gujarat, Madhya Pradesh are accounting for almost 84% of these cases, according to the statistics that are right before me. Now, why is this happening? Did we let the mask slip too early, Dr. Harshvardhan, in your opinion?
India followed a graded, preemptive, proactive, whole of government and whole of society approach in tackling COVID pandemic in the country. The graded opening up of economy and commercial activities followed a sustained decline in COVID-19 epi-curve in the country. This was essential to negate the economic impact that COVID-19 has had globally, including India. Historically, the pandemics of the past have come in waves, and COVID is no exception. This was amply witnessed when the second wave hit Europe and Americas.
Yes.
It still eludes the scientific community why pandemics behave in this way. Hence, a second wave was perhaps inevitable.
Inevitable, so it's a cycle, and no one can be really spared this cycle. Well, that seems like a plausible explanation, but I want to ask you this, Dr. Harshvardhan. Suddenly, again, we have restrictions being imposed. So there are night curfews coming back in some towns. In some other cities, you're asked to come with a COVID positive report to a mall or a public space, markets, etc. Now, are these practicable solutions? Are they constructive at all, Dr. Harshvardhan?
Physical distancing is an established non-pharmaceutical intervention to suppress and contain the transmission of the COVID virus. The modality for ensuring such physical distancing measures have to be evidence-based. In this context, partial lockdowns such as night curfews or weekend lockdowns would not have much impact on the transmission cycle. As for vaccine, there are still many critical unknowns, especially with regards to the impact on transmission and duration of protection these vaccines offer. Further, what is clear is it reduces severity of the disease and hence impacts the mortality. At this stage, vaccine cannot be considered as a public health tool for preventing or controlling the disease.
Well, there are some, I'm finding this very fascinating because as I've been saying, the Union Health Minister says that let's not go in for all these sort of curbs in this way because they're probably not in effect, they're probably not effective. But then there are obviously lockdowns that are announced overnight for one day. Some people, some politicians have described them as meaningless tokenism. So there are contradictions, Dr. Harshvardhan. Now, how do we evolve out of a situation like this? Is the government considering advice such as this, or are we just going to leave it to the states?
Lockdown has its place in the fight against COVID as it lays emphasis on the tested strategy of COVID-appropriate behaviors. Vaccine drive is expanding from 1st April to all people above 45 years of age.
Sure.
Thus, incremental increase on the priority age groups will lead to more and more people taking vaccination and will lead to check on second wave. Government has already asked states to prioritize vaccination of the priority population in areas where high number of positive cases are reported.
Okay, so you're going to sort of have a structured approach to this, a tailor-made situational approach to this. There have been concerns among some young COVID-19 patients as to how, Dr. Harshvardhan, there is a rapid deterioration in the condition of their lungs. Now, what could be the reason of for this, Dr. Harshvardhan?
We are monitoring the emerging surge in cases very closely. As of now, there is no evidence that there is a shift to younger age group as far as severity of the disease is concerned.
Okay, there are also wider concerns now about the safety and the after effects of some of these vaccines, Dr. Harshvardhan. Covishield in particular has been flagged for causing blood clots in some very rare cases. Now, several European countries have suspended the administration of these vaccines. How do you view this? Should we be worried? Should people who are taking these vaccines be worried? Or is this so random and perhaps so isolated that it's not a concern?
Such cases are being examined by the respective government of the countries where they have emerged. In India, all cases of adverse events following immunization are monitored through a well-structured and robust surveillance system. Casualty assessment of all serious and severe AEFIs are done by the designated AEFI committee to determine if event is related to vaccine or vaccination process or otherwise. Till date, as per current evidence, no significant adverse event following immunization has been reported in India.
Okay, well, that's to do with India, and I'm glad to hear that. It actually makes us feel a lot more, at least makes us breathe easy, excuse the pun. But as of March 22nd, AstraZeneca vaccine has been found to be about 79% effective in US trials without increased risk of blood clots. Now, doctor, does this give more surety on the vaccine, or is what happens in the US stays in the US and it's not applicable to Indians?
Our national regulators have examined the efficacy and the safety data from clinical trials of Covishield and Covaxin. I would like to reiterate that both the vaccines being used in our country are completely safe and immunogenic.
So you're saying that there is no cause for concern. Let me just ask you this again very directly. No cause for concern, even with regards to Covishield here in India?
Presently, there are no concerns about the safety of vaccines being used in India.
Well, that's very reassuring, and I just hope that everyone who's planning to get vaccinated in the 45+ category now takes that message away and feels reassured. Let's get this process started, viewers. It's the only way of breaking down the chain of transmission. Now, last few questions, Dr. Harshvardhan. In fact, my last question, talking of vaccine-related side effects by admission, so far, we've had a minuscule number. This is obviously not a cause for concern, but can we entirely disregard the concerns that have been expressed internationally just because they haven't manifested themselves here, or if they have, the occurrences have been very, very few?
The percentage of serious adverse events following immunization is 0.0002% of the total number of beneficiaries vaccinated, which is very less. Thus, select few cases is not a generalization,
right,
and their cause and effect needs to be established. We are taking cognizance of all scientific evidences while undertaking the causality assessment of these AEFIs.
Well, that's very reassuring to know the government's on top of the job, says Dr. Harshvardhan. Thank you very much for speaking with us. Thank you for being a patient audience here. Thank you very much.